This presentation is by Caroline Brasher, Alston James, and Meredith Ledbetter. The purpose of this movie is to inform others about electroconvulsive therapy, its risks and benefits, and the role nurses play in this treatment. Electroconvulsive therapy, or ECT, is a medical procedure that uses probes to administer electrical shocks to the brain. Most patients who are treated with ECT have treatment-resistant depression, schizophrenia, mania, or other severe mental issues.
ECT is a last resort for patients who have not responded to different medications and cognitive therapy to treat their problems, as well as those who are suicidal or at risk of harming others.
When most people think of using electric shock on the brain, they think of Frankenstein,
crazy doctors,
horrific pain,
and permanent damage to the body like a vegetative state.
However, ECT is administered in a much more humane and controlled way. Nurses and doctors carefully gather information about the patient's medical history as well as their current physical and mental state.
Patients are given anesthesia and muscle relaxants that ensure they feel no pain during the procedure.
Through probes, trained physicians and nurses administer electric shock to the patient's brain, which causes seizures and causes a change in brain chemistry.
Psychiatric nurses play important roles in ECT. It's their job to educate the patient about the procedure, side effects, and risks before the treatment. They ensure that the patient feels as comfortable as possible going into the procedure, and they monitor patients' vitals.
The risks range in severity, and the chance of relapse is very high. The most common side effects are nausea and temporary memory loss. Most severe risks include seizures, permanent memory loss, heart attacks, and very rarely death.
In most cases, the risks are the result of errors made in the administration of treatment. Because of this, caregivers must be careful to place probes in the correct places on the patient's head, use the right amount of shock, use correct medication and dosage, and monitor the patient carefully.
For a patient undergoing ECT, it's important to understand the potential risks and benefits of the procedure. Although ECT is effective, medical professionals are still unsure of exactly how the procedure works. As a medical professional, it's important to keep the patient's best interests in mind and do what's best for the patient.
Overall, electroconvulsive therapy is an effective procedure that is becoming more popular as a treatment option for extreme mental illnesses. This procedure, along with every other treatment option in the medical field, has its risks. It is up to the patient to decide if these risks are worth taking to improve his or her health.